everybody, it's Matt from RoyalCaribbeanBlog.com. Thanks for joining us here on YouTube. Be sure to check out RoyalCaribbeanBlog.com for everything Royal Caribbean related. RoyalCaribbeanBlog.com. I am very excited for today's broadcast. This has been something we've been looking forward to for months. Royal Caribbean released its new health protocols, the first initial draft. It's out. We got it this morning. We've had a couple hours to sift through the 65 pages of information. I know there's a lot of questions, a lot of things to discuss, and we're going to tackle as much of it as possible right here on this broadcast. And I have to mention, before we even got started, Mr. Bill Coco hitting me up with an epic super chat. Woo! Bill, thank you, my friend. Bill, right, funding. Because, brother, thank you for all you do, Matt. Me and my sons were scheduled for June 5th, 2021. Freedom of the Seas. Watch out, Bermuda. Here we come. My friend, thank you so much for that. And welcome to everybody here on this YouTube Monday. Every Monday, we are live here. We've got a ton of friends in our chat already. Love that. Love having everybody here. I think this is a world record. I scheduled this it's a world record for me. Earlier this morning, so there's been lots of opportunities to set reminders to join us here, but we've got a lot of people in the house. I've got Grace, I've got Josh Carruthers, Christy and Bobby Meyer are here, Tim Gallagher is here, Julie Hall is here, Carlos is here as always, Brad is here, Jay Gross is here, we've got Cary, North Carolina in the house, My Ship is Calling, Kathy is here, Olandis, Marcos, welcome. Now, before we start, if this is news to you, if you're saying, Matt, Royal Caribbean released new protocols and policies, yes. The Healthy Sail Panel produced its initial findings, initial recommendations for the cruise lines to use, including Royal Caribbean. If you want more details about it, it's right below the video here in the description. I have a link to them. You can also find them just by going to RoyalCaribbeanBlog.com. So we're gonna jump around a lot here because I imagine there is a lot of questions, a lot to discuss here. So I'm going to do my best to try to answer as much as I can. But understand, guys, this is a very new situation for all of us. We're all trying to get a grasp on it. But we'll do our best. We'll hold hands. We'll sing Kumbaya. Maybe a tequila shot or two. And it'll be all good. I think I see Becky Menken from MEI Travel is here. Welcome, Becky. Hello, Gerard, Teresa. Hello, Doris. Hello, Annette Jackson is here. Fayetteville, North Carolina in the house. Carrie from Ohio is here. Welcome. The most important question today, we'll start off with ex-Captain Mike. What about the buffet? I need to eat. You know, buried in the 65 pages, there is one mention of the buffet. This is what they said. The Healthy Sail Panel believes the removal of and substitution for self-service buffets during this time will help maintain general distancing guidelines and avoid overcrowding and should therefore be implemented across all ships. Keep in mind, by the way, guys, the recommendations of the Healthy Sail Panel may or may not be exactly what we see on Royal Caribbean. The Healthy Sail Panel made their recommendations in general for the cruise lines, right? So they gave, obviously, their findings out there. It's going to be internalized by different cruise lines, including Royal Caribbean, Norwegian, and they're going to implement them in their thing right there. So that's the only mention of the word buffet comes in that one little paragraph. Catherine is here. Hey, Matt, what a busy day for you. Katie from Wisconsin. Yeah, to say the least. My goodness. Can we just agree not to have, breaking news before coffee time? Yeah, that was... I got to start getting up, I guess, earlier. But, geez Louise. We've got Keith Bruce in the house. Welcome. Lori from Ohio. Thank you for joining us here. Let's see here. Joe Ma, can't find the super chat button. Disappeared? I think it's still there. It's that big dollar sign, my friend. Should definitely be there. Brett Ferguson is here. Welcome. Thanks for reading all that so I don't have to. Yeah, listen. I spent my entire morning sifting through. I had my cup of coffee. I'd bring out my mock cup of coffee, but it's already in the dishwasher. And I was going through line by line to go through some of these big changes. Now, there's two blog posts that are really important. I linked to the comprehensive list, the one that's got the 74 recommendations. Royal Caribbean the Healthy Sail Panel came up with 74 bullet points, okay? And those bullet points are summed up in about a sentence. In addition, they also expounded? They went into much greater detail about every single one, which is why the document is 64 pages long. It's a lot. So there's 2 blog posts I want to alert you to. One, of course, is the blog post that lists the 74. Then there's another blog post that I came out with later this morning that goes through, I think, the most important things. Because there's some things in there, guys, that everything's important, but there are things that are not going to be, like, relevant. Like, yes, they're upgrading the HVAC and doing some other things, but that has no real, like, impact on the way that we cruise. It's just going to make things healthier. So, I went on things, I looked for things, what changes, what new policies will be directly the most impactful to you and me, and that's what that other blog post is there. Joe Mock with an epic super chat. Great to be here. Had to shut YouTube down, relaunch to get the money back. Thanks for all you do. Well, I appreciate it, brother. Thank you. Don Goldstein is here. What's up, Don? That also specifically said self-service buffet. So if the staff serves it, that's a different thing. Great point, Don. Yes. Semantics are always important right there. Absolutely. Hello, Roseanne from South Carolina. Andrew says, your recap was enough to read. I can't imagine going through the entire document. Yeah, I mean, luckily I had coffee at that point because I wrote the first blog post without any coffee. That was a mistake. But then the next blog post I wrote that had, when I went through and kind of like sifted through it actually, was, okay, now I had coffee. Now I had the proper power to get through it and really tackle some of these things there. Michael Pastore is here. What's up, Mike? Welcome. Yeah, a lot of reading, Becky. Absolutely. Hello, Mark the Shark. So Mary Ellen writes, did they submit this to the CDC or just website where we can all give our opinion? They submitted it to the I'm going to read it verbatim because I want to make sure I get this right. My understanding is that the Healthy Sail Panel did submit it to the CDC. I'm going to give you the exact wording so that it is very clear on, there it is. Yeah. The Healthy Sail Panel submitted its recommendations today to the U.S. Centers for Disease Control, CDC, in response to a CDC request for public comment that will be used for future public guidance. So that's that. And Mary Ellen, was it Mary Ellen? It was somebody with the word Ellen in there. That's a really important topic there. So yes, they put it as part of the RFI in there. Don't forget, the Healthy Sail Panel comes up with the recommendations, right? Now the cruise lines are going to take those recommendations and internalize them, create policies that will be Royal Caribbean International policy, Celebrity Cruises policy, Norwegian Cruise Line policy, Oceania Cruises policy. Julie Hall with a super chat. Thank you, Julie. Thanks for all that you do, Julie. Thank you so much for your generosity, my friend. Wow. Thank you. So, let's see here. Brian Donnelly. As a type 2, but in very good control, will I be able to cruise again? Brian, there is no... The Healthy Sail Panel document does not specifically call out any group, just saying that if people there are people with special needs or, higher risk, right? These are the same groups of people that were probably at one point banned. Remember back in like March and April, there was that ban in there. They didn't say that the cruise line should ban them. They should just pay special attention and make sure that those people, like yourself, Brian, are well aware of the risks and a variety of other things there. That's a very, very good question. So I hope that makes sense. Fred Parker, need help to understand the 5-day to 24-hour testing. How will that work? Great question. First, I'm going to say thank you to Mr. I don't know if is it a Mr. or a Miss? I don't even know. Cruise Addicts. Thank you, Cruise Addicts, for the super chat. Hopefully, us cruisers respect and will follow all health protocols so we won't get banned again. Are they similar to MSC? Yeah, there's nothing in here that was terribly surprising. Pardon me. I want to go back to what Fred had said. So the testing. Fred wants to know about the 5-day to 24-hour testing. Basically, my understanding of their recommendation is that up anywhere between 5 days and 24 hours before your cruise, you need to get a negative COVID test that proves you don't have COVID. So that way you can arrive. You're going to have to arrive there in the same way that you arrive with your passport and your sail document. A negative test will be required there. Now, again, we'll get a little more, like every single policy we're talking about is going to be expounded upon. We're going to get more details about it, but that is my understanding about that, to be able to get that. So, Fred, does that answer that question? You'll have to go to some place, a CVS, a Clinic, your doctor's office, wherever, and get that. They did mention that the type of test, was it PRC? Is that the name of the, not the rapid test, the one that's a little more accurate? that one is the better choice in the short term. Ben Cohen with the super chat. Thank you, Ben. Did any of the recommendations surprise you, or was it all what you expected? PCR. Thank you, Josh Carruthers. PCR. Yeah. And thank you, Brian Carty. Yeah, the PCR test is what they recommend. They also, Ben, I'm going to get to your question in a second. I just want to close the loop on this one. The testing, it was very interesting. They mentioned that, listen, they recognize that what we know today, September 21st, is going to be very different than what we know a week from now, a month from now. There are a lot of new tests coming out. So they weren't terribly specific, like it should be this and not that. But they said if all else fails, a PCR test is the way to go. And obviously this can be updated if something more efficient, cheaper were to be done. In addition to that, so that's the test you guys do on your own. In addition, the the Healthy Sail Panel recommends the cruise lines add their own testing at the terminal. Now, that may not be practical or feasible, both financially and logistically, but all things being equal, both tests, a double layer of testing, would be ideal right there. So, all right, back to Ben's question. Did any of the recommendations surprise you, or was it what I expected? It was pretty much what I expected. I don't think there was anything in here that was significantly like, whoa. I mean, having followed what Disney World has done, having followed what a lot of other local municipalities have done as well, nothing here was terribly surprising. The biggest surprise to me, guys, if you dig into it, the Healthy Sail Panel, this comes as a surprise to me, but the Healthy Sail Panel basically said about temperature checks. So on the one hand, they recommend doing a temperature check when you get to the terminal and a daily temperature check every day. Okay, not surprising. I go to Disney World, I get a temperature check when I walk in there as well. They did say that temperature checks really aren't the end-all be-all of if someone has COVID or not. They're more, I forget the exact wording they used, but it was kind of like, health theater. But it's better than not doing it, but it's not like, the end-all be-all of what it is. So it's kind of interesting they called that out there. So yeah. Fred, my doctor's office can't schedule that within the timeline if testing is possible. How will we prove it? And then it's negative. Will they return at all costs? Good question, Fred. So number one, obviously, you're not going on a cruise tomorrow anyway. So this is, we've got time and a lot of other places. I don't know where you live, Fred, but there are a number of places that do offer testing. And they usually, the 5 days is really what you're looking at, Fred. That would be your goal. And don't do this the day before. You're going to be looking to do this, your cruise is on a Saturday, Monday or Tuesday, depending on where that 5-day window falls in there, you're going to want to get your test done. It's really waiting for it to get processed in there, right? And there are a number of places that will do it. You may have to be a little creative right now with the wording. Just tell them you think you were exposed to it. Because in a lot of cases, there's issues with, if it's for travel, will they let you in? Will your insurance cover it? That's a good question. That's going to be really hard to answer right now. It's not perfect, guys. But as it stands right now, that's what the panel recommends. Keeping in mind, by the way, the cruise line may decide to alter that slightly. We'll have to wait and see. But they basically want to make sure that before you leave, you've got a clean bill of health, so to speak, as far as you know. In addition to that, of course, the refunds. What happens if you are denied boarding? Because that is one of the recommendations. If, someone in your group or yourself, has a positive test, you're not going to be allowed to get on the cruise, period, end of story, that's it. We've seen that with, I think, MSC. They did that to a family, right? Where somebody in the family was sick and everybody else on the van was denied boarding. They haven't spelled out the policy about what happens in terms of refunds or things of that nature. I would expect it to be refunded because, you tried your best, but oops, something happened there in the end. But we don't know the answer to that one right now. So, Lady in her stamps, great name. Will the COVID test be expensive? That's a good question. I've seen prices all over the place if you're paying out of pocket. I know that the rate that I had seen, I was talking to some Royal Caribbean blog insiders earlier today on Facebook, and somebody pointed out that one of the places was charging about $110 for the test. Again, guys, there's a lot of tests that are out there. They're not all the same, and there's new ones coming out all the time, and there may very well be a gold standard and a cheaper, easier one to do coming forward. That's one of the big things we're seeing already is testing today is very different than it was a month or 2 months ago. And there's a lot of companies working to get quick, effective, and accurate testing out there. So we got some time. That's the good news because today's September 21st. The earliest we're talking about a cruise is November, which is about 6 or 8 weeks away now at this point. That's still a long way. A lot can happen between now and then. So, Brogan, in the UK, you can't get a test unless you have symptoms. Is that different in the US? Some places do say that, Brogan. But of course, you could just tell them, yeah, I've got symptoms. I can't taste anything. I mean, they're not going to give you a polygraph in addition to the COVID test. I'm just saying. If it comes down to your vacation, Brogan, I will absolutely, yes, I have a lot of symptoms. Sorry, it's just, yeah. Joe says I got a PCR test weekly paid for by the federal government. They don't ask for anything. Well, obviously you work for the federal government there, Joe, and in your case, boy, that'll be easy to set yourself up for that one. So, all right, back to the questions now. Charlie wants to know, will we all have to wear a mask 24/7? We haven't cruised before. The recommendations are not 24/7, but yes, masks will be required. So it's really interesting. This is a very important topic. Let's talk about masks, guys, because everybody wants to know about the masks. Right after I say thank you to Randy Patrick with an epic super chat. Woo! Health guidelines are a great sign of coming into cruising. Oh yeah, 424 days till the 2021 Thanksgiving group cruise on Harmony. Randy Patrick, you the man. Thank you so much, my friend. Yes. Oh, I'm excited, man. All right, we'll get to that in a second. Masks. Okay. There's good news and there's bad news. We'll start with the bad news. The bad news is, depending on your perspective, yeah, you got to wear a mask on a cruise ship. It's not a surprise to me. I'd be more surprised if they didn't require masks, but there's going to be masks required. And if you read just the bullet point in that 74 list, it sounds like you have to wear a mask 24/7. You don't. I'm going to refer you to the blog post that I wrote about masks because it is important to talk about that. So here's what they say about masks, okay? First of all, guests should wear face coverings in any indoor congregate setting, regardless of physical distancing measures, but should not be required to wear face coverings in their own cabins. Okay, now that sounds bad. That sounds like, okay, the second you leave your cabin, you're wearing a mask. Okay, now on to the next paragraph. A notable exception is indoor dining. Seating in restaurants and bars/lounges should allow for physical distancing so guests can eat and drink without needing face coverings while seated. Face coverings are not required in outdoor settings as long as physical distancing is feasible. However, if physical distancing is not feasible in certain outdoor settings, masks or face coverings among guests should be required in those locations. So the answer is you're not going to have to wear 24/7. Certainly not in your room. That's a hard no right there. But beyond that, in terms of, there looks like there's going to be some flexibility with certain venues. If you're walking the hall, if you're going from one end of the ship to the other end of the ship, face mask. If you're eating at a restaurant, the main dining room, especially restaurant, you will not need to wear a mask once you're seated there because they should be situating the tables such that it's not required. So that's what's written down in the policy. Could that change? Absolutely. Michael S. is here. Hello, Michael. Will the cruise line provide masks? Michael, I did not see anything in there about that, but I don't know if that is included. I would have to go back in to look for keywords related to that, but I did not catch. If they did mention it, Michael S., I did not catch it, but, it is what it is right there. So, BG fam, any updates from the big cruise trip protection providers and how they plan to cover COVID cancellations that are initiated by the customer? Wondering if I should be getting additional trip insurance. Good question, BG. Up till right now, I can answer this question at least as it is right now. If you cancel the cruise because you don't want to go on the cruise because you're scared of getting COVID, your trip insurance doesn't cover it. Unless you have cancel for any reason insurance. If you were to actually contract COVID, get sick, not able to cruise, this is where it gets dicey and depends on your plan. Most travel insurance plans do not cover pandemics. However, a number, but not all, of travel insurance policies have been expanded to say, okay, for COVID, we'll cover it, but it depends on your policy. So the answer is you need to check with your provider because quite simply, there isn't a blanket rule for that. I hope that makes some sense. Kim Oakland with an epic super chat. Woo! Kim, thanks for sifting through all of this. I'm not surprised about the recommendations, although disappointed by a few. Oh, well, anything to cruise again. Yeah, listen, I would, and here's the thing, guys. Kim, thank you for reminding me of this. This is very important. So important, I need a sip of water. Guys, all the things that nobody really wants to do, but we understand we have to do it. Masks, social distancing, only doing shoreline excursions, reduced capacity on the ships, guys. These are all policies that will eventually go away. Let me say that one more time. These are all policies that are only temporary in the short term until COVID is no longer a public health emergency. Now, I don't know how long that'll be, to be perfectly honest with you. That could be weeks. It could be months. Yes, it even could be years for all I know. But it is not permanent. Royal Caribbean has said repeatedly, and they repeated it again today, that they don't intend to have these policies be in place forever. It's not permanent. These are just what they need to do to get back up and going. And as things evolve, as approaches and treatments and the vaccine, they did mention the vaccine. And a lot of this is based without a vaccine in mind because, again, as of the writing of this, the Healthy Sail panel was like, we don't know what the vaccine is going to do, how it'll work, any of that stuff. So we're going to ignore it for right now. But obviously the vaccine could change a lot of this. So back to Kim's point, where she says disappointed by a few of them. Yeah, listen, this is not how any of us really dreamed of cruising, certainly not a year ago. But it is important to remember that these policies are not written forever. They will change, and the panel does recommend a lot of these kind of get rolled back at some point. So keep that in mind if that makes it feel any better. John Phillips is here. It'll be interesting to see how long the CDC says they will need to review the recommendations. If past is prologue, it could be a while. You know, that's a very good point, John. I would also point out that there's a lot of pressure externally from other government organizations. They can't, I really don't think they're going to take another, 6 weeks or something like that. It's going to be a lot snappier. I could be wrong on that, but that is my expectation. BG Fam with an epic super chat. Woo! Thank you, BG Fam. Thanks for taking all the time to answer our questions. Number 6 on Harmony is dicey, but hoping it happens. BG Fam, today was another day. No cancellations. No cancellations. No sale order extended. It's getting real. I'm not promising anything, but I'm just pointing that out. So let's look. Fingers crossed, guys. Cross your fingers while we're talking about this, right? Yeah. Fingers crossed. Absolutely. Hope, how will they handle for people going on shore excursions? So yeah, one of the major things there is shore excursions, Hope. In the short term, your only way you're getting off the ship is through a approved Royal Caribbean excursion. This is something that we've already seen in Europe with MSC Cruise Lines, some other cruise lines as well. Bottom line, you are not, in order to ensure that people are not engaging in risky behavior, in order to ensure that the tours people are going on are safe or as safe as they can be, they are recommending that especially in the beginning, the tours be limited to Royal Caribbean excursions. Now, there's a couple things I want to talk about that because again, if you read that sounds bad. It's not great. I mean, I rarely do Royal Caribbean excursions, but a couple things to keep in mind. Number one, in the very beginning, first couple cruises, we're only going to Coco Key, okay? At Coco Key, you don't need an excursion, right? I mean, if you want to book something, fine, but it's largely irrelevant for a place like Coco Key because most people just get on the island and do that. That'll be fine. That's actually what they recommend. The panel said the best scenario for the first couple cruises is to go to a private destination and just hang out there. It's a controlled environment. You're good. So off the bat, no problem with that. Number two, there is reduced capacity on board, guys. Don't forget, you're not competing with the same, however many people are on the ship that you remember. We're going to be working at a reduced capacity. We don't know what that number is going to be, whether that's 60%, 70%, I don't know. But there's going to be less people, thus you're competing with less people to get excursions. On top of that, this was actually, I got a good chuckle out of this one. The Healthy Sail panel recommended that the cruise lines discount the shore excursions while they're the only game in town in order to make them more appealing. So there's that. So keep that in mind. Philip with the super chat. K, not key. Nope, sorry, it is key, my friend. But I appreciate the super chat. Thank you. Nothing but sports. Is it true or is it clickbait that cruises will come back in November? It is still what I would consider clickbait. It's not true. It's true and it's not true. Nothing has been confirmed. No major cruise line in the United States has confirmed we're going to actually set sail on this date. So nothing but sports is a really good question. Nothing has been announced that it will in fact happen. No, like this ship on this date. it's still that vague November 1st, but nothing has changed in that regard. Does that make sense? Josh Carruthers with the super chat for coffee, masks, and shots, not necessarily in that order. Thank you, Josh. I know how much you love shots, my friend. Thank you. Appreciate that. Can I help you? They can't see you because you're on the preview's there in a second. Hi. No one is saying when cruising. Yeah, exactly. Aggie Phil, you got it. Right. Let's answer some more questions here. Don Goldstein, it looks like Clea didn't give any idea about resumption of cruising. No, so in addition to all of this, earlier or later today, however you want to look at it, around lunchtime today, Clea, the Cruise Line Industry Association, had their own press conference, which basically worked and talked about a lot of the new policies that are being proposed today. Clea did not announce any specifics over there. Can I help you both? You have to go clean your face. They can see you with chocolate all over your face. Go to the bathroom. Go to the bathroom and clean your face and then come back. Baby Emma is there. Yes, Emma and baby Olivia say hi.
Hi, baby Emma. Hi, baby Olivia.
Okay. No. Get out of here. All right, what was I talking about? Clea. So Clea reiterated kind of everything that was already said earlier today. That may not seem like it matters, but I'm going to go one step further on this, guys. And this is going to go back to something that I was talking about a little earlier about that person who had BG Fam, who had the cruise on December 6th. They did not mention anything about more cruises being canceled. They did not mention anything about the no sail order being extended. That's not like they didn't confirm it's not going to happen, but they just simply didn't talk about it, didn't mention it, which I think that is a good thing. And in addition to all of that, Clea also talked about one cruise line executive, Arnold Donald, who's the CEO of Carnival Cruise Line. He said that in Europe it took about 30 days to get ready to get a ship up and going, from like, we got to get a ship up and going to so that took about 30 days. We're here in September. Do the math, guys. There is still a little bit of runway left with that. So, Don, yeah, today's the Clea thing was not breaking news, but it was a big commitment. Basically, the point of the press conference was the four major cruise companies, Royal Caribbean Group, Norwegian Cruise Line Holdings, Carnival Corp, and MSC, saying cruising is coming back to the United States. We're ready for it. We have a plan in place, and we're good to go. So we're just waiting for permission right there, and that's a really, really good sign. C. Cole is here. Hey, Matt, are there any restrictions that when it comes to the children specifically, like how many kids will be allowed in the groups? Good question. No, there wasn't. It was actually surprising. Somebody asked me about that this afternoon. I was like, well, maybe I overlooked it. No, there's really no mention of kids beyond, like, kids under 2 don't have to wear a mask, and a couple other things, but nothing like about Adventure Ocean or kids programming or anything to that point. There wasn't anything given there. I would expect if you're going to Adventure Ocean, as of right now, again, things could change. This is a guess, so I need to emphasize, this is a guess. My guess would be that in the beginning, you'll be wearing a mask to go to Adventure Ocean, just like if you're going to school or daycare, that'd be the thing as well, right? Mrs. Thomas with the super chat. So glad we have 5 months till our next cruise so we can see how these policies will work out. Do we know how many islands have opened their ports? Great question. Thank you for the super chat, Mrs. Thomas. The answer is no, but it's also, we talked about this thing last week, which is that regardless, I feel like if an island says today they're closed, when the cruise ships actually want to resume sailing, I have a sneaking suspicion the islands are going to be like, oh, you want to come? Yeah, you can come in there. I think the cruise lines are working with the different countries to make it work. So, no, we don't have like a comprehensive list, Mrs. Thomas, of like this country is, this isn't. I think it's going to be a very fluid situation. I think it's going to be the most organic of all the situations that we've got there. So, hope that makes sense. Carlos, so if cruises do resume, does that mean that my 7-night Western Caribbean this November is not going to happen since they're stated that cruises to Coquille are preferable? I can't tell you that definitively, Carlos, but I will tell you that the recommendation is to start off with short sailings. That is the recommendation to begin with. That's kind of where they want to go. I don't know how that'll play out. Here's what I will tell you, Carlos. I think what you should be looking for is the next announcement. So this announcement today is huge, guys. This is big. This is what we've been waiting for, but it's not as much as we've been waiting for as the next announcement. The next announcement, well, next one could be that the no-sale order is not extended and it will expire, but the next big announcement from the cruise lines is a restart plan. Hey, we're gonna actually restart cruises on this date with these ships, Carlos, and then at that point, you'll have a good idea of what to expect about your 7-night sailing. Listen, if you're a betting man, yeah, it doesn't look good for long cruises in November, but there's nothing to indicate as of right now that your cruise is canceled or whatnot. How long they'll take to go from short sailings to longer sailings, none of that is spelled out there. It's really just kind of a gut check. And if it makes you feel any better, I mean, MSC just restarted cruises in Europe, and they're already back up to 7-night cruises over there. So, Fred says, may I ask any word about boarding or exiting, timelines, airline departures? Good question, Fred. No, I didn't see anything about that, about embarkation, disembarkation. Nothing more than, you should be wiping down the ship or anything like that. But I saw no mention of that. I saw no mention of consecutive cruisers, back-to-backs. Nothing about that at all. So, Captain Mike, are the pools on board chlorine or salt water? Depends on the ship, actually. Some are chlorine, some are salt water. Depends on the class. Hey, Sherry is here. Hello, Sherry. How are you? Welcome. I see Ann Jordan in here. Jeff Leonard, did the panel also specify the masks had to be cloth? The panel did mention that in terms of the masks required, they basically went off what the CDC says, which is the same thing that I know Disney World has said as well. Actually, I know exactly where it is because they basically just said you should wear the mask that the CDC recommends, which are that have 2 or more layers, be worn over the nose and mouth, be worn by individuals 2 years of age and older. Nobody under the age of 2 should be wearing a mask. No kids, no babies. They do not recommend gaiters or face shields at this time. So none of I love my gaiter, but you should not be wearing these anymore. Go Yankees. You should be wearing a regular 2-layer mask and no face shields. So that's the recommendation right there. So thank you, Jeff, for reminding me about that one. Let us see. What else we got here? Church Planning says, Royal Caribbean sent email to begin filling out travel and pick boarding for November 8th Oasis Cruise. Yahoo. Oh, are you a crew member or something like that? Because that's interesting. Hope, is there any age restriction? They said anything about that? No. Not that I saw. I could be wrong. I did not see anything to that point. Linda, I assume the cruise companies have not booked ships full. That would be common sense. Well, yes and no. They haven't really implemented the don't book ships full. One of the recommendations, Linda, is to not do that. And we're all expecting that if a ship is booked full or close to it, they will they'll basically cancel some reservations. We don't know how or what. Don't ask me, guys. I don't know the answer to that one yet. But there will be a policy for that. But it hasn't been fleshed out yet, Linda. Once it is, I think that'll be the case right there. So, Dave Lucas is here. Good day, Dave. Is there any indication that the HSP recommendations will be used by Royal to submit to the Australian government to help get cruising restarted elsewhere? Good question. That's an excellent question, Dave. I had seen no indication about anything related to Australia. I apologize. Everything today was really about the United States and the CDC. During the CLIA thing, it was the same thing. I mean, I'm sure you're not surprised to hear that. But no, I've not heard about whether or not the new Healthy Sail panel recommendations are going to be aimed at, will be also submitted to Canada, Australia, other countries that have certainly also had their cruising locked down now for a while. Megan Napson wants to know about entertainment on board. Will the shows and entertainment still be happening? Yes, there may be more shows on board, more times, empty seats in the theater to promote social distancing, but yes, those will still be part of it. Even bars and lounges were mentioned as, an option there. So, Brogan, is Royal still due to restart in Asia in October? I don't remember exactly when. That's a great question, Brogan. I don't remember when. I think it's all November 1st at this point, except for Australia, which is canceled through December. So, yeah. I think they rolled it back with they snuck it in with the Australia one the other week. Remember last week when that was the thing? I know Spectrum is back to being a restart November 1. Yeah, I mean, Odyssey from November 5th through April 17th have been canceled. April 17th, 2021. Australia through December 31st. And where's the Spectrum one? I know the Spectrum one also mentioned they canceled that one too. I don't see it in the It's buried in there somewhere, but I believe that has changed as well. Let's see here. Wendy, if flying into port, how would they stop you from going on your own excursions before the cruise, like Hawaii, for example? That's a good question, Wendy. I mean, they can't, but one of the things, number one, you're going to have a negative COVID test that has been in effect from between 24 hours and 5 days before your cruise. In addition to that, Wendy, they will do some other checks and things of that nature coming up there. There may be a recommendation or a provision that you shouldn't be doing those things. I don't know that. They haven't announced that yet. I mean, that's why people ask, one of the most common questions out there so far is, how come we have to wear masks on the cruise ship if we already got a negative COVID test? Isn't that what testing is supposed to do? But Wendy's example is a prime example, guys, that just because you got a negative test at one point, there's that, between that point and when you actually get on the ship, a lot can happen. You go outside, you go in your car, not so much, but you go to the supermarket, you go on an airplane, you go to dinner, right? You go to your hotel, you go, you do a tour, you walk around town somewhere, you drop your dog off at the kennel. These are all things along the way between that initial negative test and when you get on the ship that's not accounted for. And as of right now, it's not certain if there will be another test before you actually get on the ship. That would be something that the panel recommends, but it is not necessarily the end-all be-all the policy. So that is why you still need to wear masks on board the ship, because people are coming and going, and testing isn't quite at that level yet where you can have like a Star Trek tricorder and be like, yeah, no, you're good. Like, if it gets to that point, yeah, we won't need masks on board because we'll know, but obviously we're not there at that point yet. I think I said Mr. Ron Ladowski here. Ron says, my guess on stateroom cancellations would be they would start with the vacating inside rooms. They're close together and least financial impact if they're canceled. Yeah, it remains to be seen, my friend. I don't know. That's a really, really good question. I try not to, talk too much about that. Speculating about what could or may not be the policy remains to be seen right there. So we'll have to wait and see. Let's see here. Eric Gator, let's be honest, masks don't work 100%, so why not let people choose if they want to risk the no mask or not? Eric, they mentioned this in the policy. There is no silver bullet. Not one of these policies is aimed at being, this will stop or prevent COVID. With this in place, you're good. It's not just about masks. It's about a multi-layered approach. It's about doing all these things in tandem that, if done correctly, the risk of COVID infections on a ship is extremely low. You are right. Masks are not the end-all, be-all, 100% guarantee will stop you from getting or spreading COVID-19. Absolutely true. However, that is not the only policy that is here. It is in conjunction with the testing, with the temperature checks, with the different policies, social distancing on board, and a variety of other things that all work together to make it work. You need all those things together. It's like a mesh. You put the mesh together, it stops things. One thing, it can't stop it all. That's the logic behind it. I hope that makes sense. Because you know what? It's a fair question, Eric. A lot of people have brought that up there, and I hope that makes a little more sense. Yeah, Mrs. Thomas says, I know we all want to be safe, but I'm begging people to remember to be adults and not tattletales if they see someone not wearing a mask correctly or at all. I would say, number one, I hope that Royal is having people out there doing this. I'm going to give you the example, Mrs. Thomas, of Walt Disney World, because that's the best example I have of tens of thousands of people implementing these kind of rules, Mrs. Thomas. And they have, employees there that do walk around, and they will point out, sir, madam, you got to do that or do this. It's not the guest role; it's the company's rule. But at the same time, we all have to, make sure we're following along. One of the policies that the Healthy Sail panel made that's really important is they also said guests need to be made very aware before they go on the cruise. They are agreeing to do all of this. Not some of this, not when it's convenient, but you're basically signing off on, yes, I have reviewed these policies. I understand what I'm required to do, and I will do them. that is one of the things they do recommend. So it's crystal clear. There's no surprises. Not like assuming, right? You know what happens when we assume. So, Eric says, all the other policies I'm good with. The mask is the one that seems to be a real negative one in my opinion. And that's fair, Eric. And you know what? My recommendation to you is if that's obviously a game stopper for you, well, then I would wait it out a little longer. Eventually, that's one of the policies. The mask policy is one of them that the Healthy Sail panel said eventually we won't need to do that anymore. Don't know when exactly that'll be, but that's not, going to be forever. It will eventually go away. And if that's how you feel about it, nothing wrong with that. You just have to wait a little longer to go back on a cruise. That's all. Kyle, did they talk about what would happen if someone on the ship ended up tested positive mid-cruise? Yes. There is a ton of space dedicated to that. Couple things. Number one, there should be a number of staterooms that are quarantine rooms. They have quarantine and isolation. Quarantine is for, who asked me that question? Kyle. Quarantine is for Kyle, your buddy, your wife, whoever. They're positive. You're not, but we're going to put you in quarantine just in case. So those rooms are for that. Isolation is for when, Kyle, you have COVID-19, you're going in the isolation room, right? And then the idea is, depending on a variety of factors, you may be transferred off the ship for treatment on land, because obviously they want you not to be, stuck there. The Healthy Sail panel came up, they recommend that the cruise lines have basically small, medium, and complete ship evacuation plans. Basically, a one-off situation, how to handle that, a small outbreak, how to handle that, and of course, worst case scenario, okay, there's a lot of people on the ship now who have it. What do we do with that? So there is a contingency plans that are there to encompass all of those things there. So I hope that makes sense. And there's a lot. And guys, I do recommend you do read the policy. I know it's like really boring, but hop in there, look for the sections you're looking for, and kind of read through some of these things. There is a lot, but they do spell out some of these things. Not everything yet, but yeah. And by the way, guys, don't be too hard on Eric. He's just bringing up a fair point. He's not being a troll in here. I think he's asking a very legit question. So I hope that it kind of makes some sense. I hope that we're being adults here with kind of the explanations. So if you make a dumb comment afterwards, that's a different story. But I don't think he's doing that. So Becky says, I'm happy the cruise lines are taking such a cautious approach. One large cruise ship that comes back with COVID could mean we don't cruise for quite a while. Hoping won't be that long. Yeah, and to that point, Becky, these policies, guys, are aimed to never have a situation like that occur. Never have another Diamond Princess situation, right? That was something they bring up in the document, which is like, listen, that was terrible, but that should never happen if they knew then what they know now about this whole thing. And if the system works, if they implement this correctly and it is followed, the system will work. The system will catch it where if some person does get infected on the ship, it won't result in this just cataclysmic shutdown of the ship in which, half the ship ends up getting the virus because they don't know what to do. There's a system in place. The system will work. We've already seen that in Europe already. With some of these cruises over in Europe, yeah, there's already been a couple people on cruises who have contracted COVID-19. But the difference is those people did not, the cruise ship did not end up getting like a Diamond Princess situation. They took care of it. They isolated it. The system worked in place and they got it taken care of. So, yeah, I hope that makes sense as to the difference there, and that having a case on board is obviously they don't want to have that, but there are procedures in place, recommendations of what to do to make sure that it's not a problem. So I hope that makes sense there. Carlos says if someone does get test positive, what would happen with refunds and all that kind of stuff? Boy, that's a great question, Carlos. We don't know the answer to that one, my friend. I'm not sure on that. I really don't. So. Catherine writes, I'm guessing we'll see quite a bit of Coco Key and Labadee for the upcoming cruise. Yeah, Catherine, I think you should bet on the first number of sailings being Coco Key and nothing else. So yeah. Thiago, why cruise lines aren't saying anything about the need of medical facilities equipped with a minimum number of respirators? There is a lot actually in here. I didn't mention it in my blog post, but because a lot of it is just stuff that needs to happen behind the scenes. But there is a lot of stuff here about medical facilities and what should be taken care of here. There's stuff about ventilation, HVAC, but I know what you're talking about. They do talk about, let me get to there, onboard medical capabilities and having sufficient medical personnel on board, and that they should have redundancy and backup for onboard personnel. Do they mention the word respirator? That I don't know. The better question is, can I spell respirator? Respirator. I think I spelled it right. Respiratory. They did not mention it. And again, a lot of, just like any medical facility on any Royal Caribbean ship or any cruise ship, they're not meant to be floating hospitals. They're meant to be triage units, being able to, stabilize the patient, have them be taken care of, and then obviously move them off the ship and be treated. Okay. Ventilators. Maybe I should check for that. Let's see if there's any word about ventilators. Ventilator. I spelled it wrong. Ventilator. Did I spell it right? No. Ventilator. I got it, guys. Here it is. All right, hold on a second, guys. The panel reviewed the blah, 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 blah. Due to the fact that SARS-CoV-19 infection can result in severe lung complications, it is important that cruise operators have sufficient access to medical equipment such as bi-level positive airway pressure BiPAP machines and hospital-grade ventilators to support a patient's oxygen levels. Furthermore, it is imperative that the cruise operators comply with CDC-recommended personnel and protective equipment for medical staff caring for confirmed or suspected COVID-19 patients. So they do mention they should have ventilators and whatever the heck a BiPAP machine is. So, yes, I think bring this all around. Yeah. Whew. Man, oh man. Hope, what would happen if their staff get COVID-19? What would they do with them? One of the recommendations I just went through, Hope, I wouldn't have known the answer unless I couldn't spell ventilator, was that they mentioned there should be redundant staff, at least in the beginning. So, Ron says, cruising in April 2021, I can live with the cruise requirements, but I hope my ports of call are open. I agree as well. Absolutely. Ron McKenzie is here. Crew here. We quarantine. Yeah. I mean, listen, there's a lot of lessons learned since Diamond Princess. And Diamond Princess is like, I'm trying to think of like an example of like an airliner that crashed from like something that like now would never happen because we know better. It's one of those kind of situations, There's a lot of things that are there to do that. So, Tracy, I don't know if there's any mention of smoking. That's a good question. Is there any mention of smoking? No, I would imagine there'll be a smoking section and you would go there, but there's no mention of the word smoking, so don't know how that'll be handled. And when they start to cruise again, will they stagger to ports to open again? They didn't mention, one of the recommendations are appointments in order to promote social distancing in the terminal, to have appointments for your check-in. So it's not everybody just rolling in at once. Bergen, if my crew stays in a port overnight, what time do you have to be back on the ship in the evening, or does it not matter? It doesn't matter. It's just a floating hotel, basically. Now, that was pre-COVID, Brogan, but that was the answer back then. So, BiPAP is a CPAP. Okay, thank you, Teresa. Didn't know about that. How far before cruising will crew be rehired? So, Stacy, let me put it this way. I'm going to answer your question more broadly. Carnival said that when they started resuming operations, MSC said basically the same thing. When they resumed operations in Europe, it took them about 30 days to go from the idea to bring crew back, to getting people on board the ship, all that in between. So the answer is somewhere in the ballpark for at least 30 days. And that includes everything. That's setting sail and, that's the end goal right there. So, I don't know how long it takes to get specifically the crew back, but that's a good time frame for Carnival to expect on there. So, Michael asks, correction, if there is an outbreak on a ship, will the following cruise be canceled? No mention of that, Michael. Not that I saw, Michael. I could be wrong, but I did not see anything about like what will happen there. I think they're really just talking about how to mitigate these kinds of things right there. So, let's see. You know what? Juan Rosado said, what did I miss? Well, you know what? I want to take a quick moment here and say thank you, everybody, for joining us here. Earlier today, the Healthy Sail Panel, which is the group, the Blue Ribbon group assigned with coming up with all the new policies and procedures for cruises to be safe once they resume, they released their initial findings. There are 74 key steps across 64 pages. Don't worry, my blog post is not quite that long. And I've outlined all of it at royalcaribbeanblog.com. So there's a lot in here. And we're kind of just jumping around here, answering as many questions as I can about what's in there. I saw a question here from Mark Hamill. Will they do a dry run with crews for training? Actually, the recommendation, Mark, is yes, that should be the case. Their recommendation was, at first, you do a cruise in which the ship is docked at a pier, never leaves. You have employees come on pretending to be crew, and you do a dry run there. That's dry run number 1. Dry run number 2 is you do the same thing. Have the ship, employees come on to pretend to be crew. Sorry, employees come on to pretend to be guests, and the ship actually leaves and goes somewhere. And then dry run number 3 is doing all of that and including a port stop somewhere, so they can simulate from start to finish everything that should happen. That is the recommendation right there. Leaf, any news on Odyssey still on time for April? As far as we know, yeah. Nothing's been announced that's changed about that, so. Joette's main dining room, will they break the tables down for your party, like 2 or 3 or whatever, or will they allow you to sit with other guests? That's a good question, Joette. I don't know. They did mention, going back to the masks, that the dining restaurants would be situated to promote social distancing so that masks would not be required. I don't know what that's going to look like, Joette. Whether you'll be sitting by yourselves or still with other people, but farther away. That's a great question. I don't know the answer to that one. So, Shannon Ford is here. Says, let's say I test positive at the port and denied boarding. Okay, but it'll be like before and money lost. Or if you're denied boarding for a positive COVID test, will they give you FCC? Great question, Shannon. Royal Caribbean has not said what that is. I think that'll be the next step, Shannon, where the cruise lines like Royal Caribbean are going to take the Healthy Sail Panel recommendations. They're going to internalize them. They're going to create the Royal Caribbean international policy, because what we have right now is the Healthy Sail Panel recommendations. Because this again, remember, Royal Caribbean and Norwegian created this group, and the group created these policies for both these cruise lines and any cruise line to use and adopt. But now, Royal Caribbean and Norwegian have to both take these recommendations and craft their own rules based on them. And Shannon, that's going to be one of the rules I imagine we will hear about. I don't know what will happen with that. What happens when you're denied boarding? What happens if you catch it in the middle of the cruise? Do you get a partial refund later on? That was one of the questions we were talking about earlier. What happens if you get a negative? You're 3 days before your cruise and your kids test positive for it. Thus, none of you can go on the cruise now. What happens then? A lot of a lot of other plans to go on. And Becky absolutely right about that. Yeah, it's one of those things, guys, where we've answered a bunch of questions, right? But so many more have spawned on from there. So, it's in his word, I think, with all the checks that have to take place before you board, will the check-in process take longer? Unknown at this point. I would imagine it will, but I don't know how much. Is it 5 minutes or is it half an hour? I don't know. Hasn't been said yet. Chip says, hey, Chip Gaines is here. Hello, Chip. After my last cruise that ended March 13th, my employer made me quarantine for 14 days. I wonder, once cruising starts again, are some employers going to make their employees quarantine again? Yeah, I could definitely see that. Of course, a lot of places, not everywhere, obviously, but there are a lot of people who are working remote that weren't doing that back in March. And if you're working remote, what's the difference, right? You are basically self-quarantining. But yeah, definitely could see that there. So, Fred Parker, thank you very much, my friend. Appreciate it. Tyron from France, bonjour, comment ça va? Ronald, that is a great question about chef's table. If you do it, normally it's about 12 different people. We can't do that without separation. Glad I don't have to figure this out. Yeah, there's there's a lot of more that has to be answered. This is not the end all be all. Every question answered here, guys. And even when cruise ships resume the first sailing, I can guarantee you. Well, I can't guarantee you, but I can all but guarantee you that the policies for cruise 1 will shift from that to cruise 2 and maybe cruise 6 and cruise 14, and you know what I mean? Like, this is a learning process, and they're going to adjust, test, adjust, evaluate. That's the point. This is a scientific method about this, so they're going to do their best to make that work there. Michelle Prose is here. Hello, Michelle. Welcome. Bien, merci. Et vous? Ça va très bien, merci. Michael asks, will Royal Caribbean Group hold any info sessions with travel agents to answer questions? I would imagine so, Michael. I would imagine so. I think that is almost certainly forthcoming. I don't see anything on the calendar yet. But I would be shocked, Michael, if there wasn't one. So, yeah. Hey, Rob Jaworski is here. Good night, Mike. Mark, do you think the Florida Senator legislative stuff messes with the CDC stuff? No, I think that is just simply going to be more external pressure. Mark, I'm actually working on a blog post about that topic. So I'm actually going to be talking to an adjunct professor at a university that I don't want to say which one it is right now, but they study this stuff. Anyway, we're going to have a good breakdown of what all that means coming up here on the blog in a couple days. I don't think it'll be tomorrow, but later this week. Look for it on the blog. Let's see here. 12th Man Proud. What is going on, man? Long time no see. Yes, welcome back. Queen T wants to know about back-to-back cruisers. You know what? There's no mention of that I saw. I mean, they could be using crazy. I'll search for consecutive cruisers. Consecutive? No. Back-to-back was not a thing we'll use. There's no mention that I saw of back-to-back cruisers and what that'll be. I don't think they're really considering that a major problem because most back-to-back cruisers are a very, very small minority of people that are there. So, hey, Brad, thank you for the super chat, my friend. Good job, Matt. Thank you, Brad, for your support. Really appreciate it. Guys, thank you guys for helping me out here. I know there's tons of stuff to talk about. I mean, listen, I'm sure when you guys saw the length of the news today, you were like, holy moly, right? It is a lot. I've tried to break it down as best I can over at RoyalCaribbeanBlog.com. You can also expect new blog posts coming out here over the next days and weeks where we kind of dive into more of this. I want to make it as simple a process to understand, to answer as many questions as I possibly can. And when there is more clarification about topics we've already talked about, questions we haven't been able to answer, and everything else in between, I will definitely post it at RoyalCaribbeanBlog.com. We all have a lot of questions, but I promise you this, guys. The longer we go here, the more we will be able to answer more of these. And I would also argue, even more importantly, look at this as a major milestone. If you were like me, if you've been sitting here in these Monday YouTubes ever since March and lamenting the fact that we have not been able to cruise and have been wondering, dreaming, begging for the opportunity to go back again, this is a red letter day in cruising history. This is a major milestone, ladies and gentlemen. This is going to be what we need to get back to cruising. This is a big, big step here because then there's only another couple big steps left. And now that this hurdle is out of the way, I know there's still more questions. Don't get me wrong here, but this is a major barrier now that has been lifted in order for us to move forward to an actual restart plan. This is big. And the fact that not only was this released today, but every cruise line CEO said today they're ready to go. These policies do it. Norwegian Cruise Line Holdings CEO Frank Del Rio was asked, is this enough? Can we go today if you had the chance? And he said his words, and I quote, absolutely. That's a big statement right there. So, Tony Diaz, thank you for the super chat. After all of this information, you deserve a shot. Thank you, Tony. Appreciate that. Yeah. Juan, any news on the Icon class? Negative. So, whoo, Matt, you've done so well. You're allowed to sing tonight. That's all right, guys. So, 12th Man, what are the chances of a group cruise next year? I think they're looking pretty good. I got to tell you. Listen, we don't know yet, but this is, like I said, this is good news today. A lot of stuff in here. And if you missed any of it, guys, if you missed any of this, obviously you'll be able to watch this video back. But also, RoyalCaribbeanBlog.com. I've broken it down over there. The big news, the things you really should be paying attention to, that's over at RoyalCaribbeanBlog.com. A couple easy to read blog posts. Pull it up, take out your phone, your iPad, laptop on the couch this evening after this is over and review some of that stuff. You might have an opportunity there to kind of review everything that's there. But it's I'm breaking it down as much as I can with also a link to the full document. If you want to read the whole thing, it's epic. It's definitely waiting for you guys over there. And I'll answer one last question from Jen, who writes, just joined. Thanks for the updates. Do you know for sure when cruising will resume in the Caribbean? The answer is still no. We don't know for sure exactly when that'll happen. The good news, Jen, no other cancellations announced. The no sail order has not been extended yet. That could all change. Obviously, who knows? Maybe tomorrow morning we'll all wake up and that'll all change. But as of right now, nothing has changed. You might say, oh, Matt, that stinks. Well, Jen, I think that's actually good news. The longer this goes, no news is good news in this situation. So, yeah. We're good on that. All right, guys. I'm going to wrap this up. We are 3, 2, 1. 1 hour of live broadcast. Exactly. Lots to talk about. Thank you to everybody for your support. I want to say some thank yous to the super chatters here today because you guys, man, you helped me power through this. Tony Diaz, thank you. Brad, thank you. Mrs. Thomas, thank you. Josh Carruthers, thank you. Phil, thank you. Beachy Fam, thank you. Kim Oakland, thank you. Randy Patrick, thank you. Ben Cohn, thank you. Cruise Addicts, thank you. Julie Hall, thank you. Joe Mock, thank you. And Bill Coco, kicking it off, man, like hours ago. Thank you. We'll be live again next Monday right here on YouTube. I wonder what will change between right now and our next live broadcast because it's exciting. I don't know about you guys. I'm excited. This is like the light at the end of the tunnel is starting to appear. Like I see a little glimmer there. So I hope you all feel as positive as I do about this. I'm excited. If you have more questions, please feel free to go over to RoyalCaribbeanBlog.com, post in our comments there, our message boards. I know we'd love to hear what you have to think about it. We'll have a new video. I hope to have a new video tomorrow up on our channel about this very topic, so look for that. I'm hoping that I gotta come up with a better title. Not video lady. I'm sure she doesn't want to be called that. Our video editor, our talented video editor, has got that working for tomorrow. So look for that over there. Guys, stay safe out there. Do something fun. Maybe it's now time to book that cruise. And we'll talk again very soon right here on YouTube. Bye, everybody.